So, Dr. Smith, how do you remove a tick after it's been attached?
Well, there are a number of ways not to remove a tick, and I can go through those, but the best way to remove a tick is to have a fine pair of forceps or some other instrument designed for removing ticks to place right against the skin where the tick is attached, and to gently put traction on the tick and hope that it makes your job easier. That often isn't something that happens immediately. So you may have to be a little patient over, let's say, 10 or 20 seconds before it kind of lets go, if you will. Sometimes they're pretty well cemented in, so it can be a little difficult. What you don't want to do are things that really irritate your skin or cause danger, or sometimes make things worse by aggravating the tick, and things that sometimes people try, or uh, using some sort of heat or something against the tick, trying to smother it with Vaseline, since ticks very rarely respire. You'll have the tick on for a long time before it falls off.
Great. And Dr. Kalish, is there anything that patients can do after removing the tick to prevent the development of Lyme disease?
Yeah, often it's hard to know exactly how long the tick has been on you. If you know that, that's important, because the longer the tick has been on, particularly if it's been on for more than a day or 36 hours, it's much more likely to transmit Lyme disease than if it's just got on you that day. So if you know you were out in the yard and you see it on you that evening, probably it's not going to transmit Lyme disease. So that's one factor. Sometimes it's hard to identify the tick. So if there's concern enough, luckily there is an effective prophylaxis with doxycycline, the drug that we actually use to treat Lyme disease too. We could take 2 tablets, it's 100 milligram tablets of doxycycline. And it's been shown that that's effective up to 72 hours after the tick bite. It may not be 100% effective, but it's probably, getting pretty close to that, at least 90% or so effective in preventing Lyme disease. And furthermore, even after you do that, you will watch the site and make sure that, days or a week or two later, you don't see the typical Lyme rash coming out of that spot. And if you don't, you probably are in pretty good shape and have prevented Lyme disease with that.
If people don't want to take the doxycycline, what should they do?
Right. That's a good question. It's by no means mandatory to do that. Some people are out there getting a lot of tick bites. The best thing is try to find them quickly and get them off before they've been there too long. But even if one has been on you for a while, which you might be able to tell by whether it's bloated or not, that to some degree gives an indication of how long it might have been on. Not every tick bite is going to transmit Lyme disease. In fact, most don't, for various reasons. And so you're actually okay just watching the site for a slowly emerging sort of ring-like rash, or any rash, even if it's not ring-like, sort of out of that site, that often starts about a week later after the tick bite. And watching for other symptoms that might relate to tick-borne diseases, such as fevers, flu-like symptoms, etc. So you could just not take prophylaxis antibiotics and just sort of be vigilant for any of the clinical signs of infection. And if you treat early at that time, the treatment should be extremely successful and prevent further late manifestations.
Thank you both so much.